Smith, your doctor has ordered me to remove your Foley catheter. Would you mind just stating your name and date of birth for me? Okay, thank you. All right, Mrs. Smith. I am going to start by performing some hand hygiene. I am going to don a pair of clean gloves. I will now raise Mrs. Smith's bed to hip level, and I will put down her railing. Mrs. Smith, I am now going to expose your genital area. Do I have permission to do this? Okay, thank you. I am now going to put Mrs. Smith's knees back into the flex position. I'm going to remove the piece of tape and dispose of it. I am then going to continue to move the drapes down towards the end of the bed, and I am going to be placing a catch drape down in front of her to prevent her sheets from becoming wet and soiled. I am then going to check the bag for color, odor, consistency, and amount of drainage. Once I have written down my documentation, I am going to pour the bag into a graduated cylinder. I will then grab a 10 cc syringe and I will remove the saline, inserting it into the port. I will pull back on the head of the syringe until all 10 cc's of the saline has been removed from the balloon, completely deflating the balloon. Once I have removed the 10 cc's, I will put the syringe off to the side. I will then be removing the catheter, and as I'm slowly removing it, I will slowly wrap it around, coil it around my finger. Once I have removed it, I am going to assess it for any mucus, redness, or infection. I don't see any, so now I am going to dispose of the Foley catheter. Placing it into my drape, and then disposing of it in the right area. I am then going to be assessing the area for any redness, rashes, skin breakdown, or lesions, or sores. I don't see any, so I am gonna go ahead and remove my glove. Oh, before I remove my gloves, I'm going to check to see if it needs any further cleaning. It doesn't appear that it does, so I will not be doing any further cleaning at this time, so I will go ahead and remove my gloves. I will then perform hand hygiene. I will reposition the patient so that she is comfortable, and I will cover her peri area back up for her. I will then lower her bed back down to the lowest setting that I can go into. I will readjust her railing and lock it into place and make sure that her bed is secured and locked. Mrs. Smith, are you feeling any discomfort after this procedure? No? Okay. Well, do you have any questions for me at this moment? No? Well, your doctor should be in with you in a couple minutes to discuss the procedure and the outcomes. Here is your call light for if you're feeling any discomfort or if you have any questions. Is there anything else I can do for you before I leave? No? Okay, well, it was a pleasure. Thank you so much for letting me take care of you and perform this procedure today, all right? I'll see you soon. Get some rest. Thank you.